Trump's healthcare plan is actually quite straightforward. Is you want to make sure that pre-existing coverage conditions are covered. You want to make sure that people have access to the doctors that they need, and you also want to implement some deregulatory agendas so that people can choose a healthcare plan that fits them. He, of course, does have a plan for how to fix American healthcare, but a lot of it goes down, Kristen, to deregulating the insurance market.
There you have Donald Trump's VP pick, JD Vance, cleaning up the mess that he left behind following the presidential debate in which Trump said that he had a concept of a healthcare plan. Not a great answer. So of course, JD Vance is trying to clean up the mess. But Vance also made an extremely dubious claim about how Trump approached the issue of healthcare while he was president. So let's see what Vance had to say, and then we'll break it down with the facts.
Let's back up a little bit to 2017, 2018, when Obamacare was actually collapsing under the weight of the regulatory burdens and collapsing under the weight of lack of funding. And Donald Trump had two choices. He could have destroyed the program, or he could actually build upon it and make it better so that Americans didn't lose a lot of health care. He chose to build upon a plan, even though it came from his Democratic predecessor.
Why should voters believe that a plan is forthcoming when you've heard Donald Trump say so many times in the past that he's going to be putting forward a plan? It still hasn't happened yet.
Well, because Donald Trump actually governed, Kristen, for 4 years, and he actually protected those 20 million Americans from losing their health coverage.
Hey, don't scroll away. Come back. Because before the video continues, we just want to urge you to lend your support to TYT. You power our honest reporting. You do it at tyt.com/team, and we love you for it.
Okay, so there's a lot to unpack here. So I want to first just start off with the inaccurate claim that the Affordable Care Act or Obamacare was running out of money, which is why Trump had to spring into action during his first term and do something about it. That is not true, and I want to be clear. The Affordable Care Act was modeled after a Heritage Foundation healthcare plan that was implemented in the state of Massachusetts under Mitt Romney when he was governor. I say that because Obama implemented a Heritage Foundation healthcare plan nationally, federally. If it wasn't Obama and it was instead a Republican who implemented that national healthcare plan, Republicans would love it and they would be singing its praises. But since a Democrat did it, they hate it, and they've tried to repeal it so many times. They've tried to repeal it dozens of times and have failed. You want to know why they failed? Because it turns out that most Americans actually enjoy a lot of what the Affordable Care Act has given them in terms of protections against being dropped from their healthcare company if they have a pre-existing condition. You guys get the point. It has massive flaws, and people understandably were furious once they realized the Affordable Care Act would essentially force Americans to buy private insurance. But other than that, it did provide protections for Americans that they previously did not have. That is part of the reason why Republicans have failed time and time again in repealing it. Now, of course, Donald Trump has been a loud proponent of repealing and replacing Obamacare for years now. In his interview after being elected president, he said that the repeal and replace would be done simultaneously. On his first day in office, Trump signed an executive order proclaiming, "It is the policy of my administration to seek the prompt repeal of the Patient Protection and Affordable Care Act." And under his leadership as president, congressional Republicans tried to repeatedly do that. They also tried just repealing Obamacare with no replacement. And then they also tried a skinny, more limited repeal where they would do away with the mandate. And now the mandate is what I was talking about earlier. The federal mandate would force you to buy private insurance, and if you don't, well, then you get a penalty when you file your taxes. They tried to repeal that part, but believe it or not, the Supreme Court upheld the mandate. They did not allow Congress to repeal it. And more importantly, the response from Republicans was essentially to limit the penalty for not abiding by the mandate to $0. So essentially, the mandate is ineffective now because of the fact that even if you don't buy private insurance, you don't have to worry about that penalty. So none of their attempts, though, in repealing the plan overall worked. And Trump even endorsed a lawsuit that would have wiped out the Affordable Care Act by essentially rendering it unconstitutional. But again, the Supreme Court ruled against his wishes. So I'm gonna bring you in, John, because let's talk a little bit about what JD Vance said there during this interview, because he says, Trump definitely has a plan. He has a plan. He doesn't really detail what that plan is, but he did mention that he would pursue deregulation of the healthcare industry. That doesn't surprise me. I mean, that's usually what Republicans want to do, and doing it in regard to the healthcare industry could actually have some pretty disastrous consequences. He wasn't specific. I don't know what that means, deregulation in this context, but what do you think?
I think it's going to suck. Look, they already, during Trump's first term, they already made it possible for insurance companies to offer like less helpful plans that are not as good coverage. They can still charge for it, just not as good. They're gonna ramp that up. And you're gonna be paying for health insurance that if you have a medical emergency, you're gonna be screwed even more than you already are. So that'll be fun for a lot of people. But some people who are desperate because of the cost of insurance might sign up for them. And then it'll eventually utterly wipe them out if they ever actually need to use that insurance. So that'll be a lot of fun. And so there's also concerns about allowing insurance companies to once again not cover pre-existing conditions. If you deregulate them, that's conceivably an area that you would want to get involved in. I mean, it's such a, like the idea that he's like, I guess, waiting for Trump to actually come out with some details, but he has to maintain the fiction until that happens, that there's literally anything. Maintain the fiction that since Donald Trump said he had a concept of a plan, that he's put more than 2 or 3 seconds of thought into it, which he definitely has not. And it's just such a wildly dishonest attempt to rewrite history of what Donald Trump actually did. They campaigned on, we're gonna kill this thing because we're misreading the country and thinking that people want it killed. We're gonna try to kill it. We're gonna not succeed. Oops, people hate that. So he had a choice to kill it or to save it. No, he didn't have to do anything. He could have left it alone, actually. That's what he could have done. I don't know why killing it was an option that you think he had to face. And so now, because he spent 4 years doing nothing to strengthen, in fact, you already went through a couple of the ways that they potentially weakened it. The individual mandate obviously wasn't popular. There was a financial reason that it existed. It helped to lower overall costs by making sure that as many people are part of the system as possible.
Right.
And they also removed a couple of different cost sharing provisions. The federal government helped to defray the cost for different states. They took away some of the money that was meant to make it easier for people to sign up on healthcare.gov. They weakened it and made it more inconvenient in a number of different ways. But none of that fits in with his idea that he strengthened it in any way. Nobody has better coverage. Some people might pay less only because they have coverage that barely exists. So again, it's just a really weird rewriting of history. And I think he knows that people don't generally trust their ticket when it comes to this topic.
Yeah, and to your point, polling indicates that 62% of Americans actually have a favorable view of the Affordable Care Act. Only 37% have an unfavorable view. And that's based on a poll that was taken this year in April. And that doesn't surprise me, honestly, because even though I do feel that the Affordable Care Act is flawed in certain ways, fact of the matter is the provisions within it, there were incredibly popular provisions within it, including coverage of pre-existing conditions, allowing people to remain on their parents' healthcare plan up until the age of 26. Those things might seem minor to some people, but they're not minor. Certainly not minor when you consider that the health insurance companies basically considered everyone as having some sort of pre-existing condition. And so I remember people, just not being able to find any coverage because no insurance company would take them based off of a BS claim that they had a pre-existing condition. So I understand why it's popular, and I do also understand how the Trump-Vance ticket are kind of backed into a corner when it comes to the issue of healthcare. But here's what I really think is gonna happen with healthcare regardless of who gets elected, to be honest, nothing. I don't think anything's gonna happen to our healthcare system. I don't think anyone's gonna improve it. I don't think anyone's really focused on it. I think the fact that Donald Trump didn't have an answer during the debate in regard to what his healthcare policy would be shows that it's not even something he's thinking about or considering. And so that is depressing in and of itself, not necessarily when it comes to Trump, but just overall. that even though we still do have a flawed healthcare system, no one's really seriously proposing any detailed policy in what they would like to do to fix it. So we're just guessing what JD Vance is saying here, right? And look, to be fair to him, during the interview, he did also make clear that pre-existing conditions should be covered. So when it comes to deregulation, at least based on what he's saying, he wouldn't want to do away with the coverage for pre-existing conditions. You could believe him or not, but that's beside the point. I just don't think either party is really focused on doing anything about healthcare, period. What do you think about that?
I think we can talk about intent. We can talk about how much it might be tried. I do think it is difficult for virtually anything to get done, even if it's wildly popular, even more popular than reforming insurance would be. It is difficult to get the Republicans to go along with virtually anything being passed, particularly if it's going to cost money. And so that seems unlikely. Some of this could be dependent on the results of the election, not just at the presidential level. But I don't think that anyone is predicting that things are going to go so well for the Democrats that they're going to have free reign to do anything that they might even want to do, let alone would be able to do, if things are still as split as they are right now.
Hey, thanks for watching that video. We really appreciate it, guys. And we appreciate it if you become members, because that allows us to be independent, honest, progressive, all the things that you don't get from corporate media. And all of that is because of you guys. Hit the join button below and become one of us. Become a young Turk.